Through the use of ultrasound imaging, we offer the ability to capture quantifiable measurement of the blood flow and the size of the smallest vessels in the human body. Technically, we are able to show the effect more immediately and hope to detect increase in blood flow that are generally restricted in diseased areas. Initial scans show the largest diameter was 0.5 millimeters. The large oval black area represents the eyeball, or the vitreous of the eye. Thanks to this preliminary scan, we are able to find that there's no bulging of the optic nerve disc, which means that the intracranial pressure is normal. This measurement makes for a proper baseline to compare any biometric response from any therapeutic intervention. Next, we introduce the biofeedback energy applicator closer towards the eye. We notice, through our ultrasound readings, that the vessels have dilated about 30 to 40% during the treatment. Notice the dark band at the bottom center, which represents the optic nerve. In the bottom of the screen, before the flashes of color, you see the retina with some trace orange and blue dots. This translates to roughly a 30 to 40% increase in the blood flow, going to the area that was exposed to electromagnetic stimulation.
By looking at the blood flow in the very sensitive vessels like the retina and the posterior cerebral artery, we showed quantifiably that the blood pressure in the circulation has improved. In other words, there was more blood flow following the treatment than before. We also noticed with the pulse oximeter that the oxygenation of the body improved from 99 to 100%, and the pulse rate, the heart rate, slowed down as the body got calmer.
Patients that come into the clinic that have been in a car accident, I need to evaluate them to find out exactly what happened to the brain inside the skull. And so there are concussion protocols that we perform in the clinic, and we do it's a cranial nerve check is one of the things that we do, because not only do you have the brain sitting in the skull with a brain stem, which can be greatly affected with a whiplash scenario, but in the floor of the skull, there's 12 sets of nerves that come out and they perform different functions. And that's often overlooked. You can have somebody come in that doesn't really present as a concussion, but if they have one of the cranial nerves that doesn't work properly and we pick that out, we can begin immediately to start help that nerve system heal. So when we do a cranial nerve check, we're checking 12 different nerves where you can determine if there's any kind of cranial nerve loss due to a car accident or even sports injuries. So if we can figure out exactly what's going on in their brain, we can get to it and reduce not only the concussion, but the possible post-traumatic stress disorder and personality changes that can go along with it.